The coronavirus pandemic has marked yet another devastating milestone. Over 1 million lives have been lost due to the virus globally. That's according to Johns Hopkins University. Roughly half of the world's fatalities have been reported in just 4 countries: the United States, Brazil, India, and Mexico. But as the death toll rises in the U.S., recent data shows the fatality rate in children and teenagers remains low nationwide. A recent report from the American Academy of Pediatrics and the Children's Hospital Association says 18 states did not report a single death among people under 20 as of September 10th. Let's bring in pediatrician Dr. Dyan Hes. She is the founder of Gramercy Pediatrics. Doctor, this new study published by Science Transnational Medicine suggests that the reason why children get less severe coronavirus infections than adults is because they have a different immune response. What is that difference, and how does a child's immune response differ from an adult, and what role does that play in preventing the virus?
So we don't exactly know which part of the immune response is the major contributor that the children are getting less ill. But we do know that the children have less ACE2 receptors, which seem to, the coronavirus seems to preferentially attack those receptors and people with a higher amount of them. So that's one thing. Other thing is that the common cold virus in the United States is a different type of coronavirus, several types of coronaviruses. And we think that maybe they have some partial immunity. So like they've been exposed to other coronaviruses, and now this one won't be as terrible for them. And then the last thing is that they do have a better, more vigorous response just because they're younger and their immune system is stronger.
You know, Doctor, just a little bit earlier, we were talking about this New York Times reporting about the administration pressuring the CDC specifically to find information that would bolster their argument that it's safe to open schools, which is why I think it's really important that we're having this conversation with you now about, you know, what studies we can depend on and what studies we can't. And so I'm going to bring up another one. New analysis released by the CDC shows that teens are about twice as likely to become infected with COVID-19 as younger children. So the teens are more vulnerable. What is your take on this information? Are teens more likely to be tested and then show symptoms? Are they more likely to test positive and show symptoms?
We don't know that yet. We don't have enough tests. We don't have rigorous studies done yet. So it's all hypothetical. But what I can say is that there really have not been a lot of hospitalizations for teens, almost zero, you know, very, very limited. And, you know, thank God, there's only been 100 deaths in the United States due to coronavirus. So the question is it the risk and benefit? Is it safer to keep your kids home and have a complete failure of education online? Because I can tell you in New York City, it is a complete and utter failure. My patients are not learning. They barely have 2 hours of online school a day. There is depression, there is hunger, there is, you know, anxiety, and they need socialization, and there's loss of milestones. So if they're a teenager and they stay home and they quarantine for 14 days and they don't end up in a hospital, is that a bad thing to keep the schools open? Would be my question.
So President Trump, as you know, announced a plan to distribute 150 million rapid coronavirus tests in the coming months. How can these rapid tests impact decisions for parents in sending their children back to school?
So this would be amazing, because if a school nurse or a health representative found that a child had a fever or a cold and cough in school, they could take them to the nurse's office and do a rapid test, and it's ready in 15 minutes. And this test, I think, if it's the Abbott test that I believe that they're going to use, it's only $5 test, and they're going to be rolled out in trying to roll them out in all the public schools. Now, this would be very good because you would have an instant answer. You can quarantine that classroom, you could send those kids home, and then you can keep the rest of the school open. I mean, we are seeing more and more reports of a positive case here and there in Long Island, where the schools have been open the whole time, and the schools don't shut down. If there's more than 2 cases, they clean the school for a day, and the kids are back in school. And I'm seeing terrible depression and anxiety. I just got an email this morning. I have a well visit coming in for a 7-year-old this week. The mom wants to talk to me before because her son doesn't sleep at night. He's afraid he's going to die. He hasn't seen his friends. She doesn't want to talk about it in front of him. And we don't even have enough mental health workers for all these kids. I mean, most mental health providers don't take health insurance. So who is going to take care of these kids? I mean, I'm a pediatrician. I'm not a psychologist.
So let me ask you a question, doctor, sort of moving forward, right? My kid's in class. She's in class 5 days a week. You know, we go to, there are all kinds of protocols. Everyone's wearing masks. All the windows are open. They spend a lot of time outside. But I wonder, moving forward, as the temperature starts to get colder, you know, as a parent, I'm getting concerned about, you know, what the impact will be. A lot of kids in her school started off kind of virtual and kind of migrated back to in class. So now almost all of the kids are in class every day. Are you concerned that we are going to start to see an uptick in this virus as more and more kids show up to class, and as they're not going to be able to spend as much time outdoors as maybe they're able to do at the beginning of the school year?
I do. I mean, we're already seeing it. So there is going to be an uptick, but is that a terrible thing? Because it's going to happen regardless. So if you keep the kids at home, the parents can't go to work, and then there's other ramifications of that, like hunger and poverty. But if you can keep your kid at home after they were exposed, or if they have coronavirus, the truth of the matter is that most of these kids are having a common cold and they get better. You keep a mask on when you take care of your child so you don't catch the coronavirus from them. You wash your hands diligently, and you send your child back to school when it's over. I mean, I am afraid too. My son was supposed to take the ACT in a certain school, and we got an email from the ACT that due to coronavirus and poor air circulation, that school site has been shut down. So now my son is scared to go take the ACT. He said, like, I'm going to go to a different place. How do I know that I'm not going to get coronavirus there? I mean, there's a lot of unknowns. But if you wear a mask, wash your hands, I really still think that the schools should stay open, and the teachers that we have to work with to get them back into school, to make them feel comfortable. I mean, New York City has been an utter failure. They had the whole summer to upgrade the schools, and they did not. But I mean, you could wear a coat in school, you can have fans on, you could keep the windows open. I still think that if the rate is less than 3%, they should keep the schools open.
All right, Dr. Dyan, I know I'm always talking about my kids' school, and during this process I've been concerned about, you know, what it was going to turn out to. And I will say this, they have followed every guideline that they can, and there is social distancing, and the kids are very good with their masks, and I think they're doing the best that they can do under the circumstances, but it's still nerve-wracking as hell. Dr. Dyan Hes, thank you so much.
It is.
Sorry, go ahead.
Oh, I was just going to say the same thing. Both my kids are in school 5 days a week, but their schools are doing a bang-up job. And the kids are so happy to be back in school that they do follow the rules. That's what I've been seeing.